Hello, Ms. Stoyanova. Are you ready for your appointment?
Yes.
Okay, can you take those glasses off and come with me, please?
Thank you very much.
Please follow me to my office. Hello, Mrs. Stoyanova. Nice to meet you. What brings you to me today?
Hello. Nice to meet you too. I have problems with my eye vision, and more specifically, I'm feeling my eye very dry.
Okay, I see that you're wearing glasses. How long you've been wearing, not those glasses, but glasses in general?
In general, I'm wearing glasses maybe since I was 11 or 12 years old.
Okay, so how old you are now?
Now I'm 33 years old.
So it means that you're wearing glasses for about 20 years now.
Yes.
I saw that you're interested in the frames outside. Have you ever tried contact lenses?
Yes, I've tried. I was wearing contact lenses maybe more than 10 years, but recently I didn't feel very well. My eye is dry, and I see that it's more red.
Okay, so you feel your eyes discomfortable, they're a bit drier. Can you explain to me something more about this dryness, when it's more? During the day, do you feel any difference from the morning, lunchtime, afternoon?
Yes, of course. At the evening, I'm feeling worse. Maybe because most of the day I'm working in computer, and I have a lot of work with computer, and of course phones and tablets.
Okay, okay. Do you take any medications at all?
No.
Any contraceptive drugs?
No.
Anything else, like food supplements?
No. If it's possible, the sport.
Sport is not a food supplement. Can you tell us a little bit more about your general health? Do you have any disease at all? Any problems, like systemic problems? Have you had ever any operations, anything that are related to your eyes?
No. In general, my health condition is good. I'm feeling very good. I never had operations related to the eyes.
Do you drink enough water through the day?
Yes, yes.
Okay, so
mostly I'm
your
drinking
health.
water.
So in summary, your general health is okay.
Yes.
You're feeling okay. Your glasses are okay. You can see with them, but your main problem is that you're feeling your eyes dry in the evening. And also you were wearing contact lenses, but you're not wearing contact lenses anymore because you feel more discomfort when you're wearing your contact lenses.
Yes, that's right.
Okay, just give me a second. So we have a patient who is 32 years old. She has dry eye symptoms. She is short-sighted, and also she was a contact lens wearer, but now she is a drop-off. So my next step would be to examine her. I will start with refraction because she is 32. I'm going to measure the intraocular pressure as well. And after that, I'm going to continue with the eye examination. So Ms. Stoyanova, please follow me. We are going to do some refraction outside, and after that we are coming back here.
Okay.
Take a seat over here. Take your glasses off for me, please. Put your chin on here. Your forehead close to the bar. This is an automatic machine. It's going to move back and forward. Do not worry. Now we are going to measure your refraction so we know how short-sighted you are. And moving to your left eye now. Excellent. I'm going to measure your intraocular pressure with my other machine at the moment. This machine is a little bit funny. It has a puff of air that goes into your eyes. So put your chin, your forehead, try not to blink, try to relax. It's not going to hurt you, but it's a little bit uncomfortable because it's a jet of air that comes into your eyes. So keep calm. It's okay. 2 more. And 1 more. Okay, we are going to do your left eye now. Just keep close to the bar for me. Wide open eyes. It's going to be a little bit of puff. 1 more. And 1 more. Excellent. So just put your glasses on for me, please, and just follow me to the examination room. And take a seat. So for my refraction, I usually use an autokeratorefractometer, so I already have information not only about the dioptric power, but also about the curvature of the cornea of my patient. And I can see that this is within the normal range, so 766 corneal curvature for her right eye and 768 for her left eye. She has astigmatism which is mostly corneal, and as you can see here, the total astigmatism is actually much less than the corneal, which is actually a good sign. And here is exactly the same, so she has more corneal astigmatism than total astigmatism of the eye. So for my subjective refraction, I prefer to use phoropter. The advantage of the phoropter is that you can change the lenses very fast and patient can make lots of difference. When we are doing it with a trial frame, it actually takes more time and sometimes is not very comfortable for the patient. The advantage of the trial frame though is that the patient can take the trial frame and walk around. So for some cases you may need to use phoropter and after that a trial frame as well. There are several cases when I would prefer to use the trial frame, that is very young children because they do not like the robot. And some very old people because old people may not be happy with the phoropter as well. So I'm going to demonstrate how I'm examining the vision of my patient and how I'm doing the subjective refraction for her. So please take your glasses off for me. Give them to me and I'll put this machine in front of you. And now I would like to ask you to come closer and look through it as it is a binoculars. So what we are going to do now is examine your right eye first. And we are starting with the right eye and I'm going to give you some refraction. What I usually do, I give a little bit less myopia, especially for young people. In this case, the mean myopia is 525. I would start with 475. Can you please read the top line for me?
I didn't see it.
You can see.
Yes.
Is it any better now?
A little bit.
Is it better now?
Just a little bit.
Just a little bit. And what about now?
Now it's okay.
Now it's okay. Can you read the second line for me?
The second line, I'm I'm not sure about the first number, but the second is 4.
Yes.
Then 3, 2, and 5. But I'm not sure.
Okay, so the patient is now with vision of about 50%. So the next step would be to increase a little bit. Is it any better now?
Yes.
Okay, can you read the bottom line for me? Not really.
No.
Is it any better like this?
Yes.
Okay, can you read it?
4, 3, 2, 5, 9.
Okay, that's excellent. So now the question is, does she need any astigmatic correction? As you can see here, my autorefractor is making the astigmatic correction in minus cells. But to make it much more easy for me, I'm going to make it as a plus cell. So in this case, what I'm going to do is just do a transposition, which means 107 degrees. So I put it on 105 and just ask the patient, is it better now? Okay, just try to tell me this one or this one is better.
The previous one.
This one is
Yes.
better. So basically she is not happy with her astigmatic correction, which is by autorefraction without cycloplegia between 0.37 and 0.5 over diopter. Now we are moving to your left eye. And I would like to ask you, can you read the top line now?
3, 9, 8 maybe, but
Is it any better?
I'm seeing a little bit fuzzy. It's not very clear. The numbers aren't clear.
Is it better now?
A little bit.
Okay. This one or this one is better?
This one or
This one? Not much difference.
not much difference, yes.
Okay, again with her left eye, she has no any positive from her astigmatism. So now we are going to do both eyes. Is it any better like this?
Yes.
So now you feel okay.
Yes.
So can you read the top line here for me?
Oh,
Not really.
not really, yes.
Okay, so can you sit back for me? And I'll give your glasses back, and I would like to know what you can read with your glasses.
Okay.
Can you read the top line for me now?
Yes.
Okay.
5, 8, 2, 9, 3.
And the next one?
The first one, I'm not sure. Maybe it's 8. The second one is 4, 9, 3, maybe 5.
Okay, so with her glasses, she also has no 100% of vision. So I see that neither with my machine nor with your glasses you are having 100% of vision, which basically means that you really may benefit from contact lenses. But before we try any contact lenses, I would like to do examination with this machine. So what I'm going to do now is bring you closer to the machine, and also I'm going to switch on my other part of the machine so everybody can see what I'm doing at the moment. Can you take your glasses off for me, please?
Yes,
thank you.
course.
And now please put your chin on here and forehead close to the bar. So what I'm going to do is start to examine her eye with very low magnification. and with a neutral density filter. So in this modality I am able to see generally how the eye is looking. So it does not look like severe dry eye. You can see that the meibomian glands are fine, and there is a little bit of redness on the line of the meibomian glands, a little bit of follicular reaction. Do you have any itching at all? Not really, okay. Okay, so this is the right eye, and of course after that I'm going to examine the left eye, and it looks exactly the same. She has no any sign of Demodex blepharitis or any sign of meibomiitis. The non-invasive tear film already looks good. Okay, so after that what I'm going to do is just switch the neutral density filter and put my magnification a little bit up, and then I'm going to examine the cornea. You can see that the tear film is good, but there is a little bit of oil, too much oil. So that probably means that she has not prominent but subtle dysfunction. Here again you can see those fat spots on the tear film here and there. So basically we need to measure the tear film breakup time for this particular patient. You can see that it's quite oily tear film. And again, it's the same with her other eye as well. Quite oily tear film, and that may explain why she had problems with her contact lenses. So in situations like this, I usually prefer to use hydrogel lenses instead of silicone hydrogel lenses regarding of the generation. Now you can probably see how much fat she has, like fat blobs on the surface. Otherwise the eyes are looking absolutely healthy, and she has no redness, the vessels are normal, she has no peripheral neovascularization. Look up for me please. Just a little bit here, but probably when she was wearing her lenses for 10 years, maybe at some stage she had, but nothing serious. Okay, so sit back and relax. What I'm going to do now, because I think that I discovered your problem. Your problem is that you have too oily tear film, and that can be a result of your meibomian gland dysfunction. It's not a serious dysfunction. You do not have any inflammation, but maybe they just do not function normally. So what we are going to do now is use a piece of dye and just put it into left and right eye, and then use a special filter and see how fast your tear film is changing, how fast you're having dry spots. And if we discover this, then we may decide on some special lenses, and you can get a trial of it, and you can have some at home as well. And if you are happy, then maybe this is a good thing for you. So first of all, I'm going to wash my hands now. And this is what you should do, by the way, whenever you're touching your eyes or you're using your contact lenses. And one key thing is that you should not dry your hands with something that has a little fluff, because this fluff may stay on your fingers, yes, and then it can go under the lens and make your lens very discomfortable. So there are a variety of different dyes, but I'm going to use this one. This one is called fluorescein, and it stains very quickly. After that, you may have a little bit of staining into your nose. This is absolutely normal. So if you blow your nose, you can see a little bit of yellow on the napkin. it's not a problem. It's not going to hurt you. What I'm usually doing, I use a drop of artificial tears. I put it and then I try to dry it because I do not want to add additional water. Then I go to the patient and ask them to look up for me and just use the lateral fornix and put the dye there and put the dye here as well, and ask the patient to make a very good blink. At this stage, what I need to do is change the biomicroscopy into blue filter, and I have yellow filter inside my machine, so I push it down. So now I have yellow filter here, blue filter here. Then I just put the lights down, and then we are ready to see what exactly the problem is. We should have maximum blend open and just have a look. It is easy if we have smaller magnification. So now you can see that she has a little bit of staining, nothing dramatic, just a little bit of staining nasally, so that is a sign of a dry eye. And just ask her to blink several times, and then several times, and then open wide and look straight. Do not close your eyes. So that is the first spot already there, and now the tear film is already disrupted. That is on 8 seconds. So blink again, and we are doing the fellow eye now. Blink, 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 and just hold for me. Just hold, 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 hold. That's it. So we have a dry spot now, and immediately after dry spot the patient blinks, because if she was wearing contact lenses, and now you can see that the tear film already is dirty because of this fat, so you can see the fat as well. Okay, so you have 8 seconds of tear film breakup time. What this means? Usually you should have between 12 and 14 seconds. And if you have 14 seconds, for example, 4 blinks a minute will protect your ocular surface. If you have just 8, that means that you should make something like 6 to 8 blinks a minute, which is very fast. And you obviously do not do that. And if you do this all the day, in the evening you already feel your eyes very dry. So what we are going to do now is wait about half an hour. This dye that I put inside your eyes will be gone already. Then I'm going to put a trial set of lenses for you, and then we see how do you feel, how do you see, and then you go home and you report to me. Within 3 days, you just call the office and report how do you feel with those lenses.
Okay.
On top of this, I would like you to do a special procedures towards your lids. I want you to use a special wipes for lid hygiene. The idea of the wipes is that they clean the meibomium glands. I think that somehow you have some problems with the meibomium glands, which is still not very serious. This hygiene of the lids you will need to do for minimum of 6 months, and this is going to be enough. Just morning and evening you're going to wipe your lids with the special wipes. You can buy them over the counter, so you do not need prescription for that, but I will give you advice on the ones that I believe are best for you. So you just take one, you can divide it into 2 and use half of it for the right eye and half of it for the left eye. And you just imagine that you are having makeup, like heavy makeup, and you try to clean it. During the day, if you put a little bit of makeup, you can use it to take it off as well in the evening. In the morning, you are cleaning your lids from what happened during the night, because during the night, your lids are not blinking. So this is what is going to be. I'm going to give you a little bit of rest now, then we put some lenses and then we see how it goes from them. And finally, I'm going to prescribe you artificial tears as well. I would prescribe you a small bottles which are minims. You are going to use one no more than 4-6 hours and then you just throw it away.
Okay.
I would like you to try to use it twice a day, mostly in the evening, but if you feel more discomfort in the morning, you can use one during the day as well. Also, I would like you to keep a diary for you. So whenever you use one of those, you have to keep diary, so then we know how much artificial tears you need during the day.
Okay, now I understand. Thank you very much.
Okay, so I'm ready to try some lenses for you. I will use the special daily disposable lenses. They are going to be silicone, not silicone hydrogel, they are going to be hydrogel lenses, because I'm afraid that silicone hydrogel lenses are going to react to your tear film problem. So parallel with the lenses, my assistant is going to give you supplies for 3-4 days. You are going to use the lid hygiene and the artificial tears, which again are going to be minims, and you are keeping diary on it. So again, I'm washing my hands. It is important all the time when you're touching disposable lenses, not only for putting them in, but also for taking them off, to meticulously wash your hands. Because some people believe that when you take your lenses off it does not matter, but it actually does. Yes, they are disposable, but you are touching your eyes with those not clean fingers. So I guess that you know how to put your lenses, but I'm going to explain, and after that you can have additional explanation from my staff as well.
Okay.
The lens should be in a proper position on this finger, and then you go towards your eye. You can look straight ahead to the lens, but you also can look up and just put the lens in. The idea is that the lens is convex and the eye is concave, vice versa. The eye is convex and the lens is concave, and it goes smoothly into the eye. So you do not need to do anything. The most important thing is to prevent yourself from blinking, because the reflexes are more stronger than you are. Usually what you need to do is just to keep your eyelids like this, and that's it. Okay, I'm going to give you a piece of napkin. You need about 2-3 minutes to adapt to the lenses. Do you feel uncomfortable with this one?
The left one.
The left one, okay. Maybe you had something inside, so in such case, and you are going to do that yourself as well. You take the lens off, and because this is disposable lens, you should not clear it. You should actually take a new one.
Okay.
Is it any better now?
Yes. It's fine.
Okay, so
No,
maybe sometimes you have a little bit of dust, sometimes you have a little bit of lush, and this makes you feel discomfortable. So I would like you, if you feel more comfortable now, to look there and tell me, do you see the very bottom line now?
Yes, it's 2, 4, 5, 8, 3.
Excellent. So the difference between your glasses and your lenses is this. So this is something which you can see more clear in lenses. So because you are quite short-sighted, actually with lenses you feel more comfortable. What I'm going to do now is I'm going to leave you with the lenses, and you can go out and actually do the trial of the frames with lenses, because I'm sure that this is going to be more comfortable for you and you are going to see better. Those lenses are just as an experiment. You can experience the life with lenses for a few days. If you are happy with them, if they give you more comfort, and if I am happy with them, so I do not see any complications, then that will be an option for you. So now what I'm going to do is just quickly look how the lenses are inside your eyes. So I will go back to my usual settings now. And the lenses are moving about no more than 1 millimeter. No, actually much less than 1 millimeter. And also they have very good position. What I should say is that she still has some residual fluorescein. So this is the main advantage of daily disposable lenses when you try something. Now she has some fluorescein, but I'm not worried because those lenses are going to the bin anyway. So daily disposable lenses is something that I always use for my trial. So now the idea is that you can stay with those lenses and then you go out, try some frames. Maybe you like some frames, regardless what you decide about the lenses, you can have a great flexibility. One of the flexible things could be that you are wearing glasses most of the time and you just have a pair of daily disposable lenses in your bag, and when you go for sports or when you want to be without glasses, just put them on. That option would be that you are wearing lenses most of the time, but you have glasses for the evening. And of course there are a variety of options, including you can be happy with your lenses full time and just have glasses as a backup. At all times you have to have glasses and they should be proper diopter. So when I'm going to give you all the documents from this examination, you are going to receive several things. One is the prescription for the drops and for the wipes. The second is prescription for the lenses. The third is prescription for the glasses, and also a history and everything put in a sort of document which will inform us about your health condition today. If you lose them, do not worry. We have an electronic system and we can email them all the time. It's not a problem for you.
So not to do.
You will try not to do.
Of course.
Hi, Ms. Stoyanova. I'm glad to see you again. How are you today?
Hi, I'm feeling great, thank you. I'm very happy with my contact lenses and I hope that in future I'm going to wear it mainly.
Okay. So you did try them for 3 days?
Yes.
But together with all other measures that I mentioned?
Yes, with all the prescriptions that you gave me.
Can you possibly tell me what exactly you are doing when you're waking up in the morning?
I'm using the napkins to...
Wipes, okay. You're using wipes,
yes.
Right.
I'm using the wipes to clean my eyes, first the right and then the left eye. Then I wash my hands and put my contact lenses.
Okay, and how often do you need to put your artificial teardrops?
Not very often. I think maybe in 3 or 4 hours.
Okay, do you keep diary?
Yes, of course.
Did you show it to my assistant outside?
Of course.
Okay, and she took a note?
I bring the diary with me, yes.
Okay, good. So I think that if you are feeling good and if it looks good, I'm going to look in a minute, then you can wear your contact lenses. We are going to provide you with a special scheme so you can get your contact lenses anytime. In case you have any change of refraction, of course we can exchange, so we can take care of your lenses all the times. Of course, you have prescription. If you choose to use some other sources of contact lenses, it's okay as well. So it's up to you. So now what I'm going to do is just to have a quick look. Please put your chin in here for me. And good. Yeah, all looks very good. Your eyes are white, not irritated. The meibomium glands look a bit better, and also the tear film looks much better. When did you put your artificial teardrops last time?
Today.
Today, yes.
Today, maybe half an hour ago.
Half an hour ago.
Yes.
Okay, that explains why your tear film is so great. Okay, excellent. So I think that we can give it a try for a few months. I want to see you in a month, and after that in 6 months if you have no problems. But you have to do every day something which is very simple. You have to wake up in the morning, do your lid hygiene, put your lenses in, then you blink several times and check 3 things. How do you see? How do you feel? And look in the mirror, and if you see a red eye, if your vision is not so good, or if you feel the lens, you have to take measures. The simple measures you can take is just take the lenses off and put a fresh pair inside. If everything goes away, it's probably a problem with the lens or with dust which is under the lens. If it's not going away, you have to come and see me. Just make an appointment. We have this 24/7 phone, so you can call us and leave a message, and my staff is going to be with you as soon as possible. So if nobody picks up, just leave a message, please.
Okay.
This we are going to do for 6 months, and if everything is okay, we can convert you from your glasses to contact lenses. Great. Do you have any questions?
No, I hope that everything is going fine, and I want to thank you about everything, about for the examination and for all the prescriptions.
Okay, so just remember, if you have any question, give us a call or we have a variety of ways to be contacted. We have Skype that you have on your documents, we have Viber, and also we have email. So you can use all those means in order to be in contact with us.
Okay. I have all the contacts of the center, so...
Okay, excellent. So just before I send you, I would like to mention something more. So that was a very simple case. When somebody was disappointed from their contact lenses, they came to see me. I saw that they're interested in frames. Actually, I must say that she purchased new glasses with us as well. Now she looks very happy because she feels better, and this is just a very simple thing. She had a dry eye, a special type of dry eye, which is meibomium gland disease. It's very simple to cure, and it is very important to find this disease at this early stage. Obviously, this patient is very alert because she came on time. I'm sure that she will be able to wear contact lenses for long periods of time. If she wants to stay with lenses, I probably will try silicone hydrogel lenses as well. Again, I will try silicone hydrogel lenses as daily disposable lenses, and after that we may decide on something else. She is lucky because she has no astigmatism, therefore for her daily disposables are absolutely good solution, because for some patients with astigmatism it cannot be the solution, but for her it is excellent. About wipes, I usually keep my patients for up to 6 months, and then they have a sort of rest, and if we see that the meibomian gland disease comes back, they just have different wipes and they stay on wipes forever, like normal hygiene, washing their hair and things like this. In case when it comes to artificial tears, I usually try to reduce the number of artificial tears and try to have my patients on as less artificial tears as possible. I would like to use minims or something with a filter, but no preservatives inside. Minims has the advantage that she can always have some minims in her bag, and whenever she flies, whenever she overworks on a computer, long hours, when she stays inside air-conditioned environment, she can always use them on demand. At her age, I would prefer not to use artificial tears all the time as a patient's routine, but it depends on the case. Just in this very mild situation, it's not a good idea because we don't know what is going to happen in 5, 6 or maybe 20 years. With this, I would like to thank you very much.